In an alternative world, maybe when Reckful doesn't talk to Mr. K or Dr. K, maybe Reckful is still alive. You know, that's a false dichotomy, though. It could be the case that if he never talked to Dr. K, maybe he would have killed himself a year earlier. Maybe he would have killed himself 2 years earlier.
Right.
Maybe he would have killed somebody else and killed himself. Who knows, right? There's a ton of different potential things that could have happened that we don't know about. It's not like it's either Dr. K killed him or Reckful is alive and happy and healthy today. Those aren't the only two possibilities.
Do you have any opinions about Dr. K overall? Do you have anything you want to weigh in, or?
I feel like he does. The one thing that Dr. K does that makes me a little nervous, and I'm worried that I've been kind of like clip poisoned based on some of the things that I've seen. Are you worried about any of this stuff having blowback to your real life stuff? Or I'll caveat this very carefully because it sounds a little bit cold to say this. Hold on, aren't you a big Peterson fan?
Yeah, I'd say I like Peterson. This is where actual white supremacy is happening, because I think a lot of times...
Oh man, hold on. You might venture off into some where we're going to super fight. Go.
I think actually where... Do you overall think it was a good, fruitful conversation, or was it like mostly just a like bad, messy conversation?
It seemed really aggressive. I caught mainly the last half of it. I'm going to be honest. I was very emotionally inhibited at the time because I was playing League of Legends, so it might have been not as bad as I thought it was.
Do you think that the ethical breaches specifically increased Reckful's risk of suicide?
Yes.
How so? What evidence do you have to claim that ethical breaches are going to increase the likelihood of a client who is mentally ill with previous attempts to attempt again?
I think most people who kill themselves believe that they are too much of a burden and that nobody wants to deal with them. I think that's kind of at the heart of a lot of, at least the suicidal people I've talked to, that seems to be at the heart of their loneliness. And the combination of telling that person, well, in 4 weeks of breathing exercises, like you're never gonna have to express all that anger and sadness, and you don't have to bother anybody with those feelings. You can just disconnect yourself from them by meditating. You'll just be calm. You'll find inner peace.
Right.
And simultaneously telling him, well, you're also gonna have to talk to your parents about this. Like, you realize that, right? And then when he clearly freaked out internally at hearing that, he's like, you know what? We're gonna back off the confrontation stuff. Because I don't want to deal with you. We're just going to do breathing stuff.
Right.
That sends a message and simultaneously telling him, like, I'm the best person who can help you. I'm the best at what I do. I'm the expert. And the expert telling you the best you can do is try to stay calm, try to detach from your feelings. It'll pass. I see a deep thirst for real intimacy in the way Reckful speaks that he never got from anyone, and he certainly didn't get it from Dr. K. He was told he was getting it, which is even worse to me than being told you're not getting it.
So do you think that meditation is a valid way of like disarming people who are distressed enough to commit suicide? Do you think that meditation is like an invalid thing? Not acutely, but somebody who is like passively suicidal kind of all the time. Do you think meditation
I think you have to be really, really careful about, are you disarming this person because they're a danger to themselves and others? Are you disarming this person because you want your audience to see somebody go from almost immediately suicidal right then to being reasonably calm, and show them that you can provide the tools to get them to be there?
Which do you think it is,
or
on Dr. K's part?
It doesn't matter, because the fact that there's a question of it is the reason why you can't do this in public. Dr. K doesn't know the answer, and neither do we. And that's what makes it abusive. It has to be in private, and the therapist has to be firing on all cylinders, thinking clearly. They can't be glancing up at the purple hearts passing on the chat scroll. They have to be looking at you alone, sitting with you in your feelings, and making, with the full power of their brain and their heart, what they think is the right decision for you. And you can't do that when someone's throwing donations at you, when the audience is throwing donations at you, when they want to see Reckful cry. They want to see a show. They want to see an interesting conversation. They don't want a 5-minute pause. Reckful is the kind of client that needs needs to be allowed to have a 5-minute pause.
So I guess what I would argue is that like teaching people how to ground themselves in acute emotional distress is like one of the most fundamental skills to be teaching to clients with suicide history, because it's the best way to it's a really effective way to keep them safe, right? Because there's major predictors of suicide, right? With suicide risks, previous attempts.
Would you do that on a live stream?
I'm not talking about myself, right? This isn't about me. What I'm saying is you're kind of outlining
that
like
can be done. Do you think you can ground yourself on a live stream with 5,000 people watching?
What you outlined was like a series of like treatments that he offered that are like, when we talked about meditation, it felt like it was like this like kind of weak, limp-wristed thing that he offered somebody who was seriously, you said he didn't even realize the scope of it until like 4th episode of how seriously mentally ill Reckful was, which may or may not be true.
It's a short-term solution. It's a way to, yes, you can immediately calm yourself down and control your feelings for a moment.
Yeah.
But Reckful's problem ultimately is that his feelings were too controlled. So in one sense, yes, it keeps you alive for another few days, but it doesn't solve the problem that you are a bomb waiting to go off. And I think that you can use these two things in conjunction with each other. I'm not saying that that he shouldn't have taught him meditation. I'm saying that what he did not provide Reckful with the intimacy that he needed and that he would get from a real therapy relationship with somebody who's committed to him and able to have conflict with him, able to let him get mad at him.
So from my understanding, it was pretty clear that Reckful was absolutely unwilling to go see another therapist because he had had kind of some situations. From my understanding, basically, previously he had had a psychotherapist who basically like committed him, I believe, is what happened. So he had a very strong resistance of not getting treatment.
That doesn't matter.
So Dr. K would have better off not trying to help in any way at all, in his way, as non-therapeutically as possible, right? But to try to intervene in some way, teaching him some meditation skills, getting him to like express certain emotions that he needs to express.
No. I disagree with everything you're saying.
The most frustrating thing, I've told him this before, and we argue about this, is it feels like a lot of the conversation is restricted around just like really silly semantic distinctions.
Yeah.
Like, what does it mean to be an advocate? What does it mean to be malicious? There's sometimes it feels like there's a lot of meta conversation, and I think that and it sucks because a lot of the things he talks about, I think there's a lot of really interesting stuff to talk about. Like, in my opinion, the most interesting thing about the Dr. K thing is, let's say that there are major ethics violations of how a therapist should act, which I think is fully possible. Mm-hmm. But let's say he's doing overall, or he's contributing more good anyway.
Yeah.
Is the trade-off worth it? I think that's the really interesting conversation.
Yeah.
Did you guys did you have that conversation at all?
It felt like we couldn't go down there because then it felt like it seemed like any time I tried, because I agree, like that's the thing I'm most fascinated by, because like I said, I think insurance companies have created certain like policies and there's just ethics that are too slow that actually are preventing psychotherapists. Like the fact that no psychotherapist wanted to get on stream with him is like, I'm like, that's a problem. Like academics need to be talking and educating people about this shit, but they're not willing to because of liability, not because of morals or ethics. But it felt like it just felt, I don't know if I like drove it in the right direction. It could have just been on me that I didn't like drive that point enough, but it felt like anytime I tried to go into that, it was kind of this like deontological, like, yeah, but it is wrong and it's abuse. And so like how, like, I don't know. I just didn't know how to drive it in that direction.
Oh man, he was hammering you on that one. You don't know what abuse is. I was
like, but I didn't want to like get into a pissing match of me being like, what do you mean? Yeah. Like I'm going to get defensive here, because it's like, it's not helpful in any ways, basically.
Yeah, I agree.
But
yeah,
just
that was
so it's
another
clear,
one. Like, what does abuse mean and everything right now?
I have a pretty good understanding of abuse. I've worked with like women who have been abused, and I have worked with abusers. So like, I have actually a decent, good understanding. I'm not saying perfect, but I'm not like naive when it comes to abuse. Just for the viewers out there who are like, is she a naive idiot? I don't think so.
I also think, I think it's worth it. You almost did this as well, but you let this drop a little bit. I think that working with counterfactuals is good too. I think you asked this one time, like, oh fuck, you forced him to give a counterfactual, but you didn't actually push as hard as you should have. You asked him, well, what would you have done in Dr. K's position instead? And the answer that he gave was actually incredibly ridiculous. I'll have a private talk with you and refer you to another private practitioner, and then you can go and have that therapy. Like, if Reckful was that easy to convince, he would have just had one, right? Like,
Right.
he'd already had like horrible interactions with. Why would you talk to another mental health professional where if they feel like you are in imminent danger of hurting yourself, you're going to get committed again to an institution? Why the fuck would you ever risk that if you've already had that experience?
Yeah.
Which I think is an issue that a lot of people don't understand sometimes, for people that have had, no offense to you or anything that you do, but I'm sure that you understand that it's not many people have a good experience with the state if they've been committed to a mental health institution against their will, and they can't leave until somebody signs off on it. It's a big difference between that. Yeah. That was an answer, but when he gave that, you could have leaned really hard into that and have been like, okay, well, it's also not fair too, because you're working with the flawless, perfect information that now we know that Reckful has killed himself. And in an alternative world, maybe when Reckful doesn't talk to Mr. K or Dr. K, maybe Reckful is still alive. You know, that's a false dichotomy, though. It could be the case that if he never talked to Dr. K, maybe he would have killed himself a year earlier. Maybe he would have killed himself 2 years earlier.
Right.
Maybe he would have killed somebody else and killed himself. Who knows, right? There's a ton of different potential things that could have happened that we don't know about. It's not like it's either Dr. K killed him or Reckful is alive and happy and healthy today. Those aren't the only two possibilities.
Yeah.
Yeah.
It seems distinctly not the case that those are the only two possibilities, right?
Mm-hmm.
Yeah.
Oh, and there was another deontological utilitarian error you could have pushed him on. It's like, well, we can violate the principle of Reckful's patient confidentiality because he's dead. Well, isn't that like an outcome-oriented thing? Aren't we saying the ends justify the means there? Isn't that outcome-oriented? Like, isn't it the principle of protecting a bit? Now, you could argue, well, the only reason why we protect somebody's information is because it could do harm to them today. But now you've slipped into the consequentialist thing. It's like, oh, shit, well, there's harm being caused if we do an action, and that's why the action is wrong, not because of the principle. But bringing philosophy and ethics into normal combos is so cancerous, but yeah.
Yeah, that was anything that got like too much into like evaluating Reckful in like a very practical way, I wanted to be really careful of, because the reality is like I'm completely new. I didn't know him personally or even as like a watcher at all. And it's just like it's such a like sensitive situation, and I didn't want to basically like push him hard and like make him look, because it doesn't look good, I think, for him with his viewers to like be saying things like that around Reckful, and I didn't want to push more and make him look worse, I guess, because again, like my goal was more like friendship probably.
Sure, yeah.
Yeah.
But I mean, like, much the same way that he said if Dr. K is going to talk publicly about Reckful, he's going to talk publicly about Reckful. If he's going to cite Reckful as an example for a great harm that Dr. K is committing to kind of bolster his argument against you, then you kind of have to be willing to play on the same ground if it is an argument you're going to have, right?
Yeah, that's true.
I also think Reckful is a really interesting case to examine because he had a brother that was on SSRIs and he killed himself, which makes it really hard for you to get a prescription for any SSRI, sometimes impossible. And he'd already been committed once forcibly against his will. So this is like Reckful.
And he had attempted multiple times, right? Or just once?
I don't know if he attempted more than once, but I know that he went to an institution against his will one time.
So that means there was probably a risk of another at least, because previous attempt history is really serious once you're looking at like a suicide risk assessment.
Yeah. He might have done it. He might have attempted once when he was 16 or 18. I don't remember.
He said 16 in the videos. Yeah, he said. I've spent so much time. I know those. It was 16, but I didn't know if he. It feels like he alluded to potentially more, but he didn't like specify dates or times, so I wasn't sure. Yeah.
Yeah. Yeah, but so yeah, I mean, like the idea that he could have just been recommended to another therapist, I think is pretty silly. Yeah.
Yeah, that's fair. Yeah.
What does it mean to? Oh, go ahead.
I was gonna say, here's the thing. I actually think ethically that might have been the best thing that other psychotherapists would, because people like this is the issue. Like, I'm sure he's watching, or he might watch this later, and he's going to be frustrated. But I really do think psychologists engage in like, yes, they want to care for their client, but they also don't want to get sued. And I think like a large reason why like certain things happen is because of that. And I think like in the case where like a psychotherapist is basically like, I'm going to just refer you on, is in large part they kind of want to escape the liability. And I'm like, that's an issue actually where I think like we fail. And like some pretty major psychologists, like I don't know if you know much about Marsha Linehan. She's like the founder of DBT. She talks a lot about this, and like when she sets up DBT, she like actually like contractually sets up like basically completely different ethics that normally we would consider breaches of ethics for brand new clients, because she like recognizes that basically like as a mental health field, we completely fail to meet the needs of like acute and severe clients.
Gotcha. Where DBT was, I think, branched off from CBT almost specifically, I think, to deal with people with borderline, right?
Borderline and
Or some of the hardest to
treatment-resistant
reach.
addictions, I believe, was her main kind of two focus. But borderline was for her personal, because she has borderline.
Yeah.
Yeah.
I always, one of the things I always tell people I have very, very, very small corporate background. I used to work in like a restaurant and a casino, and then I kind of got to management and I saw how everything worked. Anytime you're confused about like why some people won't interact or engage with things in ways that seem like they should, it always came down to that, like, where is the liability at?
Always.
Because that can be an incredibly important thing. And then once you understand where the liability is, like, oh, okay, that's why this person doesn't want to get involved with this.
Yeah.
And sometimes that thing pops up in so many crazy ways, in ways that even I still miss it. I remember, I don't know if you watch any of like the cop videos. One criticism that I have of police officers so much,
Like the body cam, like real life cop videos and stuff like that?
yes, yeah,
Okay,
yeah.
yeah.
When multiple police officers are interacting with one suspect, everybody is screaming, like, "Oh my god!" Like, "Put down the gun!" Blah, blah, blah. And it's like, holy shit! Like in a high stress situation like this, why do you have
This is
50
just
different people?
adding. Yeah.
Yeah. And I believe it was an officer came on stream and he talked to me about this, and he said the reason why we do that is because if somebody dies and they're not supposed to, and the precinct starts pulling body cam footage, the first question they're going to ask you is, did you give a verbal warning? Did you tell them to drop their gun? And if you say no, I thought Officer, Sanchez, or I thought Officer Jacobson, I thought he said it, and then he didn't. Now you are fucked. Your life might be over. Yeah, and it's like,
crazy.
and then when you get that answer, yeah, when you get that, I was like, yeah, fuck, liability, yeah.
Liability is literally putting people's lives in danger in that situation. This is why part of me lists want to be like, Mr. Girl, it's the insurance companies. Like, we gotta get them, you know? Like, but I'm like, maybe that's my bias. I fucking like have a big stick.
Not even really. Is it even really the insurance companies? You could also argue that it's the litigious society that we live in as well, right? Because even if there were no insurance companies, right, it might be the case that somebody's family decides that they want to sue a practitioner because, well, my son was in your therapy and he killed himself, and now I'm going to fucking sue you. And I found out somebody else talked to him, or this person was talking to my son, and you didn't even have a real relationship set up. No, I'm going to sue you, right? So it might not even necessarily be the insurance companies. The rules that they set up are probably strict, not because they're evil, but because they have to protect themselves and their clients, who are the psychologists and the therapists, from outside litigation as well, right?
Yeah. Yeah, it's just, in general, as somebody who's like in the field and also like going to get trained to be a psychologist, I struggle a lot with liability all the time, because I genuinely think that it like hampers our capacity to care, because there's genuinely issues like I can't really volunteer at like a local group to run. I think I've already told you this. I can't volunteer to run a group around addictions because I'm a trained professional, but in that space I'm working as like a volunteer who is a professional, and so like the liability's fucked. And I'm like, I get why there's these certain things. We don't want to con people who are vulnerable, but I think we've gone like so far that now like psychologists' hands are tied to the point that like they'll never go onto social media to like give correct information or like actually give good psychoeducation, which is just like so it's so frustrating to me.
Yeah, I agree, but I mean, like, the I just read my chat, just triggered the fuck out of me, and my thought just completely escaped my brain when you said that. It's hard for psychologists or therapists to do anything publicly because they're. I remember saying the issue, the thing that sucks is that as much as we all hate that concept of liability, the second we turn our eye to a broader sphere and we see how people are acting, I think we immediately are like, fuck, that liability has to come back. We fucked up. It needs to be there. The liability doesn't need to be there for the people that shouldn't have a liability, but it's impossible to make that determination, right? There might be like a really, like the best intentioned person that knows their stuff and they want to go out and they want to volunteer and help people, and they do that. And you know what, man, liability, it just hurts their ability to get things done. But there might also be another person who's like, you know what, I know how to fix people. It's a combination of acupuncture, astrology, and palm reading. And I'm going to go out and I'm going to give therapy to people, and I'm going to tell them to stop taking their SSRIs and their antipsychotics and everything because I'm going to fix them. And now we've got a whole bunch of problems. And that person is going to look at at you when you go to sue them, and they're gonna be like, well, hold on, I was just trying to help. Like, what was all this talk about you saying academics need to be more engaged? And people are like, is it just when they agree with you? Is it right? That's the issue you run into. It's like, fuck, okay, like, one person fucks it up for everybody, basically.
Yeah. Like litigation is just so frustrating, especially with like civil courts of particularly like with American litigation, because there's a lot less in Canada that will like even get put through to actually be talked about. And I'm not totally sure why. My friend's a lawyer, and that's all I know about it. But because Canadian psychologists have like entirely borrowed our model from American, we basically like mimic all of these things, which means anything that American psychologists are like reticent to do, we are. Even if the like legal precedent isn't there.
Sure. Yeah.
Yeah.
Anything else?
Don't think so. Maybe I'll check chat and see if there's anything else. Pretty. Don't know. Do you have any opinions about Dr. K overall? Do you have like anything you want to weigh in, or?
I feel like he does. I feel like he is exceptionally good at conversations. He might be really good at manipulating people, and I actually don't notice it. But I think I used to be really manipulative when I was younger, in my early 20s, but I've matured and mellowed. And I've had lots of conversations with lots of people, and I feel like he's genuinely pretty good at understanding and reaching people. So in terms of that, I think he does a good job. I don't think he's just like a manipulative, horrible person that's just trying to get people to cry. Although I understand that the allure sometimes for the chat can be at that. I think that his mission and everything, I largely think it's pretty good. The word therapy just sucks because everything, like conversations with friends can be therapy, right? We like
Thank you.
People trauma dump
I wasn't
on
out to
Twitter.
lunch when I said the what is therapy is an important conversation, right? Okay.
Yeah, and you're
I was
not
like,
gonna get
am
those-
I dumb?
Yeah, no, that wait, did he? I might have missed. Did he say there was like a strict definition for that?
He said like it's not. It's obvious. Like it's very clear what is
Oh my
therapy and
God,
what
that
isn't.
is,
And I was like,
that
what?
is so
I was like,
absolutely not
maybe
true.
am I just this like terrible unethical practitioner? Like I feel like it's very difficult, especially as somebody like I worked in live-in residences where it's like, okay, well, I'm your therapist, but now I'm walking around the house. So if they talk to me even emotionally in that moment, is that therapy in that moment? Do I need to take therapeutic notes on that? Like yes, no, like we always did just to be extra careful, but it's like.
And even before, even there's competing therapeutic models between therapists that disagree on what therapy is. So the idea that there's like a consensus on this is obviously therapy. Like somebody that works in psychodynamics or psychoanalysis is going to disagree with somebody that works with other models or like that. Yeah, no, I don't know. That's kind of silly, I think, to say that it's obvious. And then there are tons of psychology is like philosophy. In that it doesn't really matter what you think about it. Everybody does it. So it's important to try to pay attention to the details. Whether you like ethics or not, everybody practices ethics. Whether you like philosophy or not, everybody practices philosophy. Whether you like psychology or not, not in some ways, in every way. If you engage with another human being, you are practicing psychology. And there are things that you can even learn in therapy. Like as a therapist, I'm sure that are important to other interactions that you have with people in your life. Like there are
just
techniques,
like basic nice skills.
being like reflective with language or like understanding, asking people like how do you like. It's very, very, very rare in real life that somebody is ever asked, how do you feel about a particular thing? People really like the opportunity to share that, right? That's like a therapy technique or whatever. There are tons of that would drive me crazy. I think I would jump down somebody's throat if they would have seen that conversation. That it's so obvious what therapy is. It's totally not.
It's really frustrating because like I've literally talked with multiple coworkers about this all the time because it's like, okay, well, if my friend, like I've literally had situations where friends come to me and they're like, hey, I have this anxiety stuff, I'm dealing with this, and I'm like, okay, and they're like, I can't really afford a psychologist, could you just give me like a couple of tips? Yikes. Right? And you're just like, like I could just give you I could just like literally psychoeducate you for 2 seconds, and just like if you were an economics student or even somebody who's an economics professional, you could absolutely give people tips based on your expertise, right? But like it just stresses me out.
Yeah, for sure.
Yeah. What do you think therapy is?
Was that rhetorical, or are you actually asking me?
It's like half glib, I suppose. Oh. You can answer if you want.
I don't know. I would say that like therapy. We might have disagreed on this, I think, in our first conversation. But like I would argue that like therapy is a place you go to for somebody to help you acquire the tools to deal with problems that you wouldn't otherwise be able to deal with in your life.
Yeah.
So if there's some stress or anxiety, or if there's some issue that you're dealing with, and you feel like you don't have the appropriate mental tools or mental faculty to deal with it, then you go talk to a therapist, and then they help you acquire some process or some introspection or whatever in order to deal with those problems. That's what I would say therapy is. But obviously, this can be a really good friend, a parent, a mentor, or a psychologist or a therapist. Yeah.
Yeah, that's fair.
Unless medication is involved, that the line gets really, really, really blurry.
Yeah.
Man, even that when he was saying like, I think Dr. K was was working as a psychiatrist because he was talking about medication. Even that's a really blurry line. Like that's a conversation that like if a girl mentions something like, oh, like I blah blah blah, it's like, oh, well, did you change your birth control? Like, am I a psychiatrist now? Am I practicing psychiatry because I'm asking a question like that?
Yeah.
Or there's a
Yeah, and like Dr. K was like redundantly careful about like anything psychiatry, anything medication, right? Like it's pretty obvious based on what I think that like Dr. K is pretty opposed to like most drugs, not like medications, but like psilocybin. I mean, but he really, really tried to be careful when he talked to Reckful about his psilocybin use, even though I think most people would agree it was probably more than was healthy.
He was doing 2 grams of mushrooms a day.
Yeah.
So
yeah.
It was a lot. Yeah.
It's a lot.
Let's see what else.
Somebody. Oh, sorry. Go ahead. I'll ask. There's a chat
I write down
question.
my shit so I never forget.
Nice. Good lesson. Somebody was asking. Oh, it just disappeared. Shoot. Somebody was asking if they felt like there was logical inconsistencies in the ethics morality conversation. I think they asked on NotSoErudite's side. I'd be curious on either side, to be honest. I'm not just here to like throw somebody under the bus. Like I'm curious about both.
I mean, like I would say that there were on his side, it felt like he was more on the defense and you were on the offense, even though he spoke more because he was kind of defending his positions. So if you were being inconsistent, it's hard to see. But the issue is I don't know if I could say that he was being inconsistent because he probably just has a different definition for literally every single term he uses than what I would use. So it's hard to say that like this is inconsistent, you know?
Yeah, that's fair. What about my position? Do you think that where I was delineating between like liability, ethics, and morality was inconsistent?
I don't think I heard you stake out as many positions because it felt like it was more of a conversation relating to his. Can you remind me, or
I can just even state them if it's helpful? That might
go for it.
Basically, I viewed liability as a question of basically insurance and like not wanting to be liable. Liability bleeds into ethics because ethics, as far as psychological practice, has to both take care of the client, take care of the practitioner, take care of the field of itself, and cover liability, right? Because anything that's outside of the ethics of the professional board, your insurance company isn't going to cover you for.
Sure.
And so I basically said, if you violate an ethics of that harms a client, it might be immoral too. Like it might be a bad action. Whereas if you violate an ethical policy that's more about protecting psychology as a field or putting yourself at risk for liability, I'd say it's not necessarily moral.
Gotcha. I think we would probably agree. The only thing is the words you use when you talk about liability. I think that liability is a real ethical concern that there is a tension there that needs to be, like, let's say that I can't pick my kid up from school and I need somebody else to give him a ride, and that person agrees. They're doing me a favor. They're going out of their way to do me a favor. That's awesome. But if they get into a car accident and they kill my kid, I'm going after that ass. And if they're like, well, hold on, I was just doing something nice. Like, what the fuck? It's like, bro, when you enter into a certain relationship or engage in a certain action with somebody else, you are assuming some level, explicitly or implicitly, some level of liability for that person's care.
Okay.
So I've noticed a couple times it seems like you have, and I can maybe understand if you're working in the field, that liability thing literally just hangs over your head as a fucking insurance question. And also because personally, we don't like to think of ourselves as like liable in a way that we could do harm to somebody, because I don't think we generally think of ourselves that way. But I think there are like ethical. I think liability is an important concept, even in an ethics point of view, not just like for the damn insurance companies.
Is that basically because of these like implied social contracts, sorry, and basically certain liability accounts for implied or explicit social contracts that you should ethically uphold, regardless of whether insurance would come after you. It just happens to be that insurance. So is it that liability is ethical, or that certain liability policies guard certain ethical principles?
Sure. Wait, are you asking me that, or
Yeah,
is that
sorry, that
what
was a question. Is
Yeah,
it
I
the
mean, I would
case?
say that like ideally, like ethics is here, and like law is downstream from ethics.
Yeah.
So I would hope that like insurance companies and the values that they guard is downstream from whatever we believe is like morally the correct thing. That would be like the hope.
Okay.
But yeah,
Okay.
obviously it doesn't always 100% align in that way. But yeah.
Yeah. Okay, that makes sense.
But we probably largely agree there. I noticed that you frame it a lot in a pretty fuck the insurance companies kind of way.
Yeah.
Um,
Yeah, probably because, yeah, in my position, I'm frustrated often. But I can
Yeah.
definitely understand that. It's probably just like anything that I think would like ethically be responsible. I think I'm a bit of like a virtue ethicist. So that's like anything that I think you're ethically responsible, I don't really care if insurance upholds it. I'm just like, obviously you should, right? But that's
Sure.
probably
problem with
almost
the
arguably
virtue-
naivety.
Yeah, the problem with virtue ethicists though is that everybody believes they're virtuous.
Yeah.
Which
Yes.
is the issue, because then every behavior becomes justified almost.
Yeah. Yeah.
The one thing that Dr. K does that makes me a little nervous, and I'm worried that I've been kind of like clip poisoned based on some of the things that I've seen. I have no problems with therapists incorporating spirituality into their conversations with clients as long as they're upfront about it. I know that it's relatively common if you see a therapist that has like a religious or spiritual belief, they should bring that up in session 1. Do you want me to talk about it through this lens or not? Or if it makes you uncomfortable, you can find somebody else. I think that's pretty standard. And I think Dr. K gives the same disclaimer. I think he'll say, I feel like he said that to be like, do you want to have me talk about it through this lens? If you don't, then I don't have to. So I'm okay with that. I always get a little bit worried when it goes a little far. Like, I think that spirituality is a really good way to put a cohesive story to some kind of like discrete psychological or biological underpinnings that aren't as sexy or fun to talk about. I think that like stories and Ayurveda and all that can be a cool way to do it. But if it feels like that thing has become the driver instead of like the passenger, then I get a little bit worried. And I feel like I've seen some clips that make me wonder a little bit, especially one about how people's doshas could like predict the severity of their COVID-19 disease. Maybe
Yeah, it didn't look great. I guess whenever I've watched him, and in fairness, I haven't watched all of him, but in the last week I've watched probably 18 to 19 hours of him. I find that he very much typically uses it in more of a like mythological archetype spiritual paradigm. And I would say, to be honest, I haven't heard him make many disclaimers of like, are you okay with this? Are you not? I think he does usually the first time, and then he kind of just always jumps into it as like kind of a firm thing. And so in general, like when I watched that clip, he was talking about specifically like dosha predicting, but the thing about dosha is it's very akin to like what we would just call like a personality test, it seems.
Yeah, this is what I was saying, is that like there's a name for this in stats, but like let's say that I create 2 new types, and I say like I've got like the Garba type, and then I've got the Durfta type,
Factor
and
analysis?
the Garftas are always wait, what'd you say?
I think it's called factor analysis, where you're teasing apart separate factors.
Yeah, maybe, but there's some. The term was latent variable.
Okay.
It might just be that I've created a new class, and it maps onto some other variable that's way more explainable. It's not about the Gupta or the Dartha. It's that all of my Gupta people happen to have a BMI of 22, an IQ of 140, and no comorbidities. And the other people that I said were in the Dartha group or whatever, these people are all obese. And it's like, wow, look at how strongly predictive my other thing is. Like, okay, well, hold on. There are other variables that are more important. And I don't know how like doshas are determined.
Yeah.
Somebody said you look at the veins in the hand. I don't know if that correlates or maps on to like cardiovascular health or obesity or anything. So
yeah, because it seems like he often tells people what their dosha is, and he obviously isn't like looking at their hands super closely on Zoom. So I don't know much about dosha, so I could be wrong. Like he could be interjecting spirituality too much. But at least in like most of the like conversations I saw all of the Reckfuls and then Yanni and somebody else, I can't remember who else. I found that usually it was like exclusively archetype. And
Yeah.
I just like, in general, I can understand if people are like problematic. It's just like archetypes that are oftentimes like deeply true for a reason. And my main contention would be like, if you're a psychotherapist who does this, there are going to be clients who don't like it. And so that's necessarily like either you need to change your practice for those new clients, or you need to like outline it from the beginning that you engage in more mythological, because some clients love that shit. Like it's so deep and meaningful to them, even if it's not spiritual. Yeah. So I never found too many issues. Obviously, if he's being like prescriptive about like whatever, I don't know much about dosha, so I don't really know. But yeah.
Yeah. Yeah. Anything else?
I don't think so. Yeah, I can't think of anything else.
Who's your next big conversation scheduled with?
That's a good question. I don't remember, which is why I write everything down. But I'm not joking right now.
Are you worried about any of this stuff having blowback to your real life stuff, or?
Not at this point. I think like a lot of times, like most people in academia, they don't even know that like Twitch exists. In general, I should say I'm not. Of course I am, because I understand how like trial by media and witch hunts can work. And so it's like, regardless of if I've done something right or wrong, it could have blowback on me. I think because of that, there's been a lot of stress. Like it's definitely been stressing me out, because it feels like I can't just be above reproach. I have to appear well beyond reproach. That's kind of feels like the standard for, and I think that's why it's tough for professionals. That's why they don't want to get on like spaces like this, is because they have to be like not just above, but beyond, right? And that's a really high bar. I try to do my best. I'm really trying to approach this as being like, yes, I've got my training in this, but I don't want to engage in like too much appeal to authority, and like, let's try to look at like data and evidence, not just like listening to me because of this. So like, I'm trying to do my best of like, if I have something to say, I should probably have 1 to 2 articles as to why I'm saying it. And if I don't, I should be very careful to caveat with my opinion, right? And so that's probably why I'm streaming less, because I find streaming right now has been very straining, because I'm constantly like running through like what I'm saying and thinking, because I want to be both as like honest as possible, without basically like giving people like too much ammo if they like decided that they like hated me and like wanted to tear me down or something, because that would be my main concern, is like pissing somebody off and having it blow back in my face.
For sure.
Yeah. Or like misspeaking, but that hopefully I don't like say something so like egregious that yeah, that at that point.
In terms of like number of patients you had, would you say it was like above or below 50 unique patients?
Like over time, like in total?
Yeah.
Oh gosh. So here's the issue. I've done a lot of group therapy. So do you consider everyone in my group therapy sessions, which changed?
Sure.
Patients?
So it sounds like you've had quite a few. I would say that, yeah.
And I've done like at-risk, like in-house support work where it's like therapeutic. It's not therapy, but there's like 10 of them that exchange constantly. So it's like, are all of those my clients, or only the ones that are like talk to? I don't know. So probably more than like at least 400. And then depending on if we say yes to like exchanging people in that room, more than like 2,000 minimum. Yeah.
I'll caveat this very carefully, because it sounds a little bit cold to say this, and I don't mean it that way, and I know you don't mean it this way. Well, I'm assuming you'll agree with me, but maybe you'll totally disagree with me.
Yeah.
But I'm sure that, especially in a therapy setting where people are coming to you for help, after somebody has said a few things, you start to pick up the threads of like, I understand, like, this is probably this person's problems. These are probably the questions I need to ask. We're probably going to get into this area, right? You start to develop like a feel for what's going on. I think streaming will get easier, because I think that similar thing will happen where you'll kind of get used to caveating. You'll like the topics that you talk about will start to repeat quite often, and it's not like you're gonna have to need a new study every single day, but it'll be like, oh, it's this question again about like, are women happier today than they were in the past, or is medication actually effective? Do SSRIs work, right? And you'll have like this working library of like, oh, here's this, here's that, here's that, or whatever. So I guess it's easier over time.
That's fair. I don't know what the cold part was in that. Was that just like analyzing people from a kind of like a heuristic standpoint?
Yeah, but I think you have to be really careful when you do that, because I don't know if you were aware of this when you first time. You might have been. I have really bad experience talking to people that have gone to school for psychology, because they act very fucking cringe. Like they act in ways that I would expect a person that goes to psychology school to never fucking act. So the idea that like you talk to somebody for like 15 minutes and you're like, oh, I can tell that you have an avoidant dismissive attachment disorder, and I can tell that you're definitely like very high in neuroticism and probably low above. And it's like, what? Why the fuck are you even like that? Kind of like the very cringe, like, oh, like I'm psychology and I am Sherlock Holmes and this is my mind palace and I've literally analyzed every single person I meet. Yeah. So that isn't what's going on when you talk to somebody where you've instantaneously boxed them into everything. But like you develop like a feel for it's like when this person starts talking, it's like you can get a feel for where the conversation is going.
Yeah, and it's actually part of standard diagnostic process. You basically when you learn like a model of diagnosis, and it depends on what model of diagnosis you're working out of. Obviously, the one I like the most is you basically like you start with client history, and I try to approach it from like a bio first, psycho second, social, because bio is a little bit easier to track. Kind of. I mean, that's hard to say, but like it's a little bit less, there's less factors going into it than psycho, right? Where it's like what contributes to your psychological presentation is way more multifaceted. So usually I start with kind of asking about like certain like physical health stuff and then family history, right? So if I know that there's like a strong family history of like ADHD, I'm starting to create a hypothesis chain. So I'm like, okay, well, if there's a strong likelihood of these things, okay, well, anyone who comes in, if they're presenting with any mood disorder symptoms, those two, anxiety and depression, have to go immediately on the docket of possible diagnoses, right? And you start kind of going with like, what are the most probable, right? Let's go with things that are statistically the most likely. That's usually the best rule of thumb. And then you try to like basically disprove each diagnosis and be like, what are reasons that this doesn't fit? That's usually how I've been trained to approach diagnosis. And so like you absolutely use like tons of heuristics, right? Like especially if you're in a setting that works with a pretty regular set of disorders, right? Like mood disorders become like pretty easy to tease apart. And if somebody has something that like pretty obviously doesn't match mood disorder, it like sticks out, you know? So that's been mostly my experience. You get to use like a structured interview style as well. So you have a guide to work off of as well.
I'm kind of curious, working in a clinical setting, do you ever worry that you start to run down a path on a certain diagnosis for an individual and that it might be very hard to break you out of that and that you might get stuck on one or two because, how do you deal with that? Or how would you in the past have dealt with that?
I would say like having coworkers that you like confer with is super, super helpful because everyone's going to have their own natural biases towards like diagnoses that probably we just find more interesting to some extent.
Sure.
And
or based on their clinical experience.
Yeah, or we like working with more. So like there might be this implicit part of like, oh, I hope people are this diagnosis because I definitely know what to do with this and I have a really good track record with them. So I think like that's why when somebody goes into like private practice, it's like fundamental that they find a peer group to like consult with. Obviously, when you consult in like a private practice setting, you have to be very careful about confidentiality, but you can broadly talk about clients in details of like diagnoses that you don't need to give them any like identifiers of like, oh, well, they're like 6'3" and like they live in this area, right? Like, I think that is the best way to prevent that. And the tricky thing is I actually think like we need to get way more structured. So the reason why I really like forensic assessment is because it's like math. Like you just go down a list of static traits and you just do some like 1, 2, 1, 2, math, right? And then you just kind of do the statistics around it and it basically just tells you, right? Like, and it's super simple because like human error is a really big issue in psychology, obviously. Like, yeah. So that's broadly... Is that answering your question? I feel like I don't need to go on if I've answered your question.
Yeah, conferring with other people seems to be really important.
Yeah.
Or using tools that are independent of your own personal...
Tools and stats are really important, like really, really, really important and definitely like undervalued, I think, sometimes in certain fields. I also was going to say regarding kind of like how some people in psychology are like the worst for it, I would say like, first of all, students for psychology are oftentimes the worst for it. Usually people who are engaging in behaviors like that, I would hope that like the vetting process of practicums, working with peers, and the EPPP, which is like the formal test we have to take to be actually licensed as a psychologist. I basically hope that those people be vetted out because there's absolutely people who go into psychology because they're trying to understand themselves and their family. And I find those people are oftentimes the most likely to engage in like psychoanalysis and diagnosis of other people that is not wise to engage in.
The last time I looked up numbers on antidepressants, it was actually unbelievable to me.
It's depressing.
Okay,
That wasn't even
good
meant to
one.
be a joke, but that ended up
Yeah.
being a terrible joke.
I want to say it was, I don't want to misquote it, but it was something like, wasn't it like 35% of all women in the US had been taking an antidepressant in the past year?
Look at the kid
Might have been.
stats for Tranks, if you just want to like hate pharmaceuticals.
Well,
Children
hold
under
on.
6 taking antipsychotics.
First of all, that's pretty crazy. Okay.
Yeah.
You say hate pharmaceuticals. I think I see another divergence of where we are. Hold on, aren't you a big Peterson fan?
Yeah, I'd say I like Peterson.
Okay.
What
It
do you
feels
think I
like,
think about medication based on that statement?
Well,
What heuristic have you applied to me right now?
what here? What you're starting to fall in? Are you vegan? Just curious.
No.
Okay, just wondering.
Very opposite. I promise I'm slightly more interesting than I appear. Maybe. I don't know. That's probably not wise
Do you think
to
you
say.
appear exceptionally uninteresting?
Yeah, I feel like I appear exceedingly basic.
Have you thought about
white
like
girl.
dyeing your hair like crazy colors or getting a septum piercing or?
Well, septum piercing is difficult in my field for higher ability, but I will probably get a magnetic one.
I bet you could go to some
But I-
office in fucking Vancouver or Toronto where they have fucking piercings and your
I don't
therapist
want to
and
go
people
to
are like,
Vancouver and Toronto. I want to stay
Okay.
in bumfuck nowhere.
oh my god. Okay.
Yeah.
Sorry. Hold on. Okay.
Also,
backing
what does
into this.
septum help? Because lots of white girls have septum piercings now.
True, but don't we? There's a weird social phenomenon where, in order to be unique, we have to find the things that we all agree make you unique, which by definition makes you not unique.
That's
So it's
true.
like a weird, right?
I never thought of it that way, but that's
Yeah.
true.
So yeah, it is what it is. Okay. I'm sorry. Hold on.
I hate
You-
pharmaceuticals is what you're responding to.
Yeah, I know what I'm responding to. I don't need to remind me. I'm just
Okay,
thinking how
sorry.
the
TBI, I'm just
vector of
projecting
attack I
on
want to
you.
use on that. So I'll be the most charitable. I'll ask you broadly.
'Kay.
Well, okay. I'll tell you what the alarm set off in my mind. After the insurance companies early and the pharmaceuticals now, I'm wondering if you think that like SSRIs and all of those, that whole classification of drugs are just kind of like a hoax, or they're not good, or it's placebo at best. And
I'm so
the only
glad
reason
you're
these
asking.
drugs exist is just so that pharmaceuticals can fucking milk us for all of our fucking money. And
Shady
yeah.
goblins. Right, yeah. I'm glad you're asking to clarify that.
Yeah.
I am by no means anti-medication in any way. I am concerned with our prescription levels right now. I think it is self-evident that there is an over-reliance on prescriptions. And I don't think that's just practitioners' fault. I think as a basically, if you're not willing to prescribe as a doctor, usually they'll just go find somebody else who will prescribe it to them. So it's
Yes.
it's both. I definitely am not like big pharma is mean. I think like big pharma has certain benefits. They don't look great with the opioid crisis, right? So there's definitely
sure.
some sus weird stuff going on. But then we have the opposite where people just want quick fixes.
It's really hard to talk about any problem because I feel like incentives can be aligned in so many different bad directions. And when you talk about certain things, people get really mad. A really good example of this is a while ago, a lot of people got mad at me because I said the housing crisis in the United States was also driven by a lot of greed from individual homeowners. Now, they weren't the primary cause and they weren't
How
the only
dare you.
cause, but people wanted to get big fucking houses that they knew they didn't have the money for, and they fucking did it because
Think
the banks
about the
wanted to sell-
proletariat, Destiny. What do you mean?
Yeah, exactly. Shut the fuck up. Don't even say that word. You're feeling realize it, right? But I noticed, I read this, it was on one of the medicine subreddits. I don't remember what it was, but it was a doctor that responded. It was a really interesting post. It was basically somebody made a post where it's like, pharmaceutical companies just trying to sell us medication. The doctors don't give a fuck about making us healthy. They just want kickbacks from big companies. And I think a doctor responded. He was like, are you actually fucking serious? Do you want me to give you a real response to this? And the guy was like, yeah, what are you, a doctor? And he's like, I am a doctor. I'll give you a real response. And the doctor's response was basically like, half the patients that he sees come into his office, if he was to write them a real prescription to make their lives better, it would be like, you need to exercise a fuck ton more. You need to stop smoking. You need to go on a diet. But he can't write that prescription as a doctor. When patients come into his office, they expect some sort of solution for the medical problems they have. So if they have hypertension, he's going to prescribe something to lower their blood pressure. If they're like pre-diabetic, he's going to get them on an insulin pump or something. The only thing that a doctor can do once you presented with some condition to a medical office, they can't make you a healthy person. All they can do is make you not dying, is to get you to some baseline. And there's a big frustration because citizens or people on the internet or whatever will have this adversarial relationships with pharmaceuticals and doctors, like, well, all you guys want to do is fucking medicate us. And it's like, well, yeah, that's all they can fucking do. And then what's worse is what you said, and this was true of the housing crisis too. If I go to a bank and they're not going to give me one of these awesome, sexy loans for a home, well, fuck you. I'm going to go to the bank down the street. So now the bank is like, okay, well, fuck. Should we write some of these irresponsible loans? If we don't, and we decide to be the good company, well, now my employees are going to go, fucking starving because I can't pay the money. My business is going to go under. The people that owe me are all fucked. And I think it's similar with doctors and therapists too, where it's like, okay, well, if everybody's saying that SSRIs or, Vyvanse, ADHD drugs, whatever, we have to have these things, and, you're not willing to prescribe them, it's like such a toxic environment. It's so hard to, I don't even know where you would begin to break through. It has to be like a holistic change in the whole system, from the pharmaceutical to the doctors to the patients to culturally how we even view medication and everything.
Yeah, totally, right? Because that, like, I'm sure most doctors would love to tell people, like, hey, if you have like pre-diabetes, like, here are some like basic health changes that you can make. And the reality is, like, no, everyone's gonna be like, fuck off, I don't want to do that, right? And they might be willing to do that, but then the likelihood of relapse is also like 60% for people who are like pre-diabetic. So it's just this like noxious cycle. So I'm definitely not anti-medication. I am concerned when doctors are putting children on tranquilizers, mostly because I think that that's a situation where the child isn't like desperately begging for the tranq. The parent might be, but I think because parents are actually typically, when we take care of people, we're more willing to do more work on their behalf than we are even for ourselves, right? So if my dog is sick, I'm going to like give her meds right on time. I'm going to make sure she's eating the healthiest food and she's walking every day and everything that the doctor prescribes and then some, because she's something that I take care of. And then you fucking ask me to do that for myself. It's unlikely. And so my concern with doctors prescribing young children tranks at a high rate is, yes, you're like solving the parents. And you could argue, well, the parents might just doctor shop till they get a doctor who will give them tranks. But I imagine that there's a bit of both going on. And it's deeply, like, strong stimulants and tranks are very scary to me to put children on, because I don't think we actually know the ramifications of putting developing brains, particularly on tranks, because of how important engaging with like new experiences and stimuli is for a developing brain. Like, tranks actually scare me more, even though there's less damage that they do to the brain in like a physical way. Yeah,
I think I agree. One thing that I kind of worry about, and it's kind of like, this is a very normative, very ethical question to ask. And I know that psychologists and probably everybody that's like a scientist hates the idea that like, it's not about philosophy, it's about science or whatever. But it does seem like there's a huge philosophy in what we pathologize. And it makes me a little bit nervous that society kind of becomes so hyper restrictive in terms of the types of minds that we can have. Like in the Western world, we're looking for minds that can sit in a classroom, be very attentive, absorb a lot of information.
Yes! Thank fuck you're talking about this. This is so important. Yes.
It's like that's the only type of mind that we can accept. And I think that when we look to pathologize things, we're not really looking at we are looking at what's healthy or unhealthy, but it's what's healthy or unhealthy with respect to the current society we have. And as that window narrows for acceptable minds, more and more stuff becomes pathologized. And it's like, well, is it really that surprising that ADHD is like fucking whatever percentage of kids are being prescribed medication when like that's like the only mind that's compatible with today's society.
When the level of attention that's required of a 6-year-old is probably at like the third deviation of what most children are ever able to give at any time.
I had a trauma response.
Wait, should I interrupt you and be aggressive here?
The first day that I dropped my kid off at kindergarten, I felt so bad for him. Like I was like, dude, you're actually about to suffer, because I hated school. I fucking hated everyone. And I dropped him. I was like, oh my God, I feel so bad for you. But sorry, go ahead. I did cut you off.
No, you're good. Yeah, it's actually why genuinely I think I'm going to homeschool my kids until at least like grade 5 or 6, because I think like the demands that we put on like really, like when people are like, not only am I going to put them in kindergarten, but I'm going to put them in pre-K by 3, and I want them to know like their mathematics, and I'm just like, why? Why?
Oh, because you want to be that fucking kid in kindergarten that could already read on the first day, that the teacher's always calling on while everybody else is still learning their fucking sight words or whatever. Fuck yeah.
And I'm going to give a spicy take. I actually think that this is where actual white supremacy is happening, because I think a lot of times...
Oh man, hold on. You might venture off into some shit where we're going to super fight. Go.
I think actually where a lot of the expectations around certain things about like what makes somebody functional is like deeply prescribed with like what is like... And when I say white supremacy, supremacy, I don't really mean white people. I actually mean more like inherited from like traditional European-centric worldviews around like Protestantism, work ethic, Enlightenment era, that kind of stuff, which I'm giving the label white, not because I'm like slapping it on only white people. I just think it's like an easy heuristic.
We have a traditional structure that was largely inherited from Europe. The only thing is, I've seen people say things like black people don't learn math like white people do, and it's like, I don't know how I feel about that.
That's cringe. That's real cringe. It's just
but
like,
I do agree that there's like a hyper.
Yeah, we kind of do like, this is right, and it's like being Protestant and like working until your body breaks and like all these things is like right and moral. And I'm like, that's not fucking moral. The fact that we're moralizing it is actually the problem. Like, it just is. It's just a cultural thing. And there are other cultures that don't give a fuck about climbing like the academic hierarchy, or they don't like care as much about like certain things. And that's fine. Like, you don't have to care about like attending and reading like every fucking book of research until you're like 21 and you like are an encyclopedia. Like, that doesn't matter. You might be like super nice.
So I think I was going to ask this question, and then you sidetracked me by baiting me with the most hyperbolic statements possible.
Sorry, I'm learning to be a rhetorician. What can I say? I'm just kidding.
Yeah, good one. Good one. There's a lot of people that are dealing with issues related to like depression and anxiety and shit today in society. Wait, hold on. Okay, if I'm keeping you up late, you can tell me to fuck off also.
I think you're 2 hours ahead of me, so more so if you need to go to bed, just let me know.
Okay. I can go to bed when I need to go to bed. I don't need your permission. I'll just hang up. I'll just fucking hang up and leave. Okay? I don't need your fucking permission to go to
Mommy
sleep.
Kyla's sending you to bed, Destiny.
Okay, calm down. All right. Okay. Oh, fuck. Hold on. I'm sorry. Do you think you have any experience with depression?
Personally?
Yeah.
Yes, I had one major stress episode where I was actually like kind of suicidal as well. I was like passively suicidal.
What was the experience like for you?
What do you mean? Like, do you mean it in like a physical, like how did it feel, or what was the, like, what do you mean by that? Like cognitively?
How would you describe it cognitively?
Oh, deeply self-focused, and I don't mean that in a moralizing way, being like depressed people are selfish, but self-focused in like a really terrible way of like constantly like focused on like where I was suffering and unable to get myself out. And it's not because I wasn't willing to, or I was just trying to think about myself, but because it's like something like within me was constantly driving me back to just like look at the fact that I was suffering and struggling. Does that make sense?
So you're kind of like sucked back to focusing on something. Would you describe this as like maybe thought spiraling or something?
Yeah, and like ruminating, but it was like, by the time I was in this stage, like I had a decent number of like counseling CBT skills that I knew, and it was like, it didn't feel like I could get out on my own, in large part because like the major stressors that were triggering a lot of this stuff weren't alleviating. And so it was like, no matter what CBT I did, I was like, yeah, but here's like this evidence of like why nobody fucking likes me. And then I would like be analyzing like all the reasons why, and I was trying to dig myself out by being like, maybe if I can like self-improve, then people will like me and then I won't be sad and stuff like that. And it just is like this toxic cycle of like, now I'm more sensitive and like focusing on myself and reading into how people are viewing me because I'm constantly worried that people think I'm a bad person. So it was like very much like an internalized self-view.
If you felt like you had the tools as a therapist, why couldn't you just work your way out of it?
Because
wait, hold on, don't give me the answer of like, because this is how this thing is. Just from your personal perspective, why not?
Yeah, no, I wasn't gonna do that. I like smile because I'm like, it's so complicated, right? There's so much. Probably in large part, why couldn't I get myself out?
So you had the tools necessary. If you were talking to somebody else, you would be trying to show them the way out. Did you see the Marvel movies?
Okay.
Which ones? Sorry. I've seen a lot of them.
Infinity War?
Yes.
Yeah, the guy he's like, I'm guiding you to a treasure that I can never possess or whatever. That was a lot of just a shitty, quick Marvel reference. But like, you have the way to guide somebody to like, okay, well, if you have depression, this is how you can help you. Why couldn't you just help yourself? Why couldn't you figure your way out of it?
I think for me, so I have a lot of like pretty early childhood stuff. And I
Okay.
wasn't actually aware at the time. I actually didn't find out until about 2 years later, just like childhood abuse and SA and stuff like that I had no idea about, because I was an infant at the time. And so I think for me, a lot of like distress that I have, like you can argue that like depression can be a top-down process where like your thought spiral, and CBT treats that really well. But for me, depression very much felt like a bottom-up experience where I constantly had this bottom-up of like the deep trauma that I had bubbling under the surface. And then when something from above, like my environment, added a stress to that, it's like I crumbled and I couldn't get myself out. And I couldn't think myself out now because I had to fix like what was going on at like I don't want to say a body level, but kind of like a body level, where it just like it became this like self-feeding, like like the snake Ouroboros that like eats its own tail. I felt
Did
like
you feel
I
like
got
you had
sorry.
like access to that area of your mind, or was this like in an area that was?
I just felt like my brain. So I hated mindfulness. Like I knew I should probably engage in like meditation stuff because I like knew statistically it helped. But anytime I would like do a meditative practice, it was the most deeply distressing thing. I would describe it as like I literally felt like I was peering into like a chasm of just like darkness, and then at the bottom there was like somebody screaming, and I was like, oh fuck, I don't want to do that. Don't even want to look in there because it's really distressing to me. So it was like a very deeply like mind psychological thing.
How many people? This is a hard one,
Oh.
and I understand if you're not comfortable giving an answer. How many people that have? I'll ask this in two parts. How many people that say they have depression do you think experience depression like this? And how many people do you think that are diagnosed with depression experience depression like this?
That's a really good question. I don't know if I could give you any numbers, even guesstimating.
I'm just I don't want you to like 42.87%,
Okay.
but like you think that like the majority of people that have depression are probably having an experience that is similar-ish to what I'm describing, versus there might be a lot of people that are just like pretty sad and unhappy, but they don't have that experience.
I think a lot of depression is more. I feel like I'm projecting with this. I feel like the reason why I resonate with a lot of people when I like talk about my experiences with certain things is because I think it seems to me, at least anecdotally, that a lot of people struggle with just that, like sometimes thinking your way out of something when you're just like deeply unsatisfied doesn't really work, because you can't think your way out of being unhappy with like your entire like quality of life around you, right? Like no thought challenge is going to like fix the fact that like your life maybe just like kind of sucks a little bit, but you don't know what's wrong and why. I think a lot of times when people like experience depression, it's kind of like a catch-all label of like, to me, depression is mostly like a flag of like system-wide there's something going wrong. But to say that it's just like a lack of serotonin or like a thought spiral, it's like, first of all, there's like two forms of depression that we're pretty aware of now, which is a stress depression versus a biological form of depression. I think biological form of depression is something I don't know at all. My mom has it, and I don't experience it because it cycles regardless of events. I think the struggle for me was that like, I think, so there's people who like just their life kind of sucks, but it's not deeply traumatic, right? I think there's a lot of people that are trying to justify the level of distress they experience by calling certain things traumatic that maybe they were, maybe they weren't. And then there's other people who have just like actual trauma. And I would say like the depression is arguably probably actually some sort of diagnosis we don't have yet, which is like childhood trauma syndrome, whatever that diagnosis would look like, right?
Gotcha.
I think something's going on in like our society specifically that is like causing people to be deeply unhappy, even though there isn't like a specific thing they can like put their finger on and say like, this is why I'm just not very happy or content in life. That's just my experience with it, at like purely anecdotal. I have no evidence for anything I'm saying, but yeah.
Okay.
Gotcha. Is that answering what you're asking?
Yeah, I think so.
Is there a purpose behind the questioning? Like, what's the goal of the question? Because there's a distinct line of thought that I think you're having.
Oh, yeah. Good job, because I'm asking a lot of questions about a certain topic. Nice.
I'm an empath, okay?
Oh my God. Wow, you're totally in my brain. I have like, up until I was 30, I have like I I don't know what it is, but I have a very, 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 very high degree of resiliency. No depression. No, like even in the worst parts of my life, like I have a very like go get them, move forward attitude. I have to work 60 hours, 8 hours a week, whatever. Fucking do your shit. I'm relatively happy. Even when I'm like miserable, like my baseline is still like really high, really good, everything. Had a really, really, really big drug experience when I was 30 that just destroyed my world for a solid year afterwards.
Was it acid or can I ask which drug?
It was a lot of mushrooms.
Okay, psilocybin.
Yeah.
Was it all for sure psilocybin? Because sometimes people sell the wrong
It was
thing.
absolutely psilocybin.
Okay, so you were tripping.
Packed the mushrooms, and I thought that like I'm gonna do a huge dose because I don't think it's real or whatever, blah blah, and I just fuck my shit up hardcore.
Okay.
But after, in the year that followed, I ran into a few emotional problems that I'd never had in my entire life. One was panic attacks. I'd never in my entire life had a panic attack. I don't want to say that I looked down on people that had them, but they just seemed so stupid. And I remember the very first one I had, I was on my computer, and it was just very strange. I was on my computer, and then I felt my heart kind of went up a little bit. And I thought, and I actually, the second it happened, I even thought, because I just joked with another friend earlier that like, oh my God, like what if you could meme yourself into having a panic attack? And I remember that I got up and I turned around and I started walking up the stairs. And by the time I got to the top of the stairs, it's really hard to explain it. I've heard it described a lot as like an adrenaline feeling, but it's not at all a fight or flight. It's like this absolute impending sense that you're about to die. I don't know how to explain it in any other way. Apparently I was hyperventilating. I wasn't aware of that at the time, but when I sat down on the couch, the person that was with me was like, yeah, you're like breathing a ton or whatever. And then after that, I dissociated for the rest of the day. And I've never had that experience before either. Like sitting in a room, staring at a wall, feeling like everything is not quite right or not quite real. There's not like a word for that. It's just very, very, very strange. But then after that, like on and off, I had these very weird periods of something that I would describe as, I tried to look up a word for this. I think it's anhedonia.
Oh, loss of pleasure?
Yeah.
So like you can't, like things that you enjoyed before were just like empty. It's almost like color came out of the world at an experiential level.
Yeah, I am such a high driven person. When I wake up, I want to play games. I want to play music. Everything is just so like, everything is like so much fun for me. I love doing everything. And I'd never in my life been in an area where I was like sitting down and everything just seemed like impossible to have fun with. Like listening to any songs, wouldn't do anything. I have no drive to play games. I don't want to talk to anybody. I don't want to do anything. And the coming into the drug experience and then coming out of the drug experience, I kind of had this vision of my mind where you have this like 5% of this kind of like unconscious mood that sits underneath everything. And then about 95% is like, this is the part of your mind that you can control. You can exert a great degree of influence over your mood and your behaviors and your feelings and everything. And then coming out of that and then moving through those periods of like minor mental illness bouts or whatever, it flipped completely to like, I think I have like 5% is like my cognitive processing, and there's so much going on underneath the hood that is like inaccessible to me. That was very, very, very scary to me. Yeah. You used a lot of different words than what I would use when you talked about your depression, but it sounded like a similar experience. I think the way that I ended up explaining this was because like before my mushroom trip, I think I talked well about mental illness. I'd have people email me like, oh, it seems like you understand. It's like, yeah, I do, ha ha ha, whatever, because I could say the right words. Even though I felt like I had a decent understanding, I knew I would never, ever, ever take a drug. I would never take like a pill to like fix my mind because I'm too smart for that. I'm too cool for that. I would never do it. But man, when I got hit with this shit, I was like, I would have done electroshock therapy to get out of whatever that was. And I had this feeling that I'm so smart and I have so much control over my mind, but it felt like every single thought that came into my head was already poisoned. It was just like, you didn't have the opportunity to think your way out of anything or to work your way out of anything, because by the time you already got it, it's already fucked. And to be robbed, I think, of that like cognitive faculty, to already be like losing before you can even have a thought, that was like such an alien thought to me. And that it was just working through, I say working through it, but I didn't, thank God. It all just kind of like came and went in these very short periods. And I remember that like I had like, there was a period where I look back at these texts sometimes, it was so unbelievable. I'm like texting my kid's mom saying shit like, I'm a horrible person, like take Nathan away from me, I don't ever want to see him again, like I'm a horrible, don't blah blah blah. And it's like, I'd never say anything like this in my life. I'm the most high driven, like confident person. It was like crazy to me to see it. But I sometimes when I listen to people talk about mental illness now, I don't want to say that I'm not trying to be gatekeeping or anything, but it's hard to tell like what are the experiences like. Is this a person that's been sad for a long time, or it felt like after hitting some of these periods, there's like this whole world of emotion or something that's beyond normal mental health that you can sink into. And the two worst parts about it was, one, after I got out of it, anytime I would have a day where I would feel slightly off, I was horrified that it was about to come back and there was nothing I could do to stop it. Yep. And then the second thing was when I was feeling it, it was like this indescribable feeling of like being in the bottom of a pit and everybody else is just like walking past you and you have no connection to them.
Yes.
And you have no idea like what you're thinking of or your thoughts are feeling. You're
That's a really good description. I remember, so for me, the depression wasn't as intense for me as once. So when I realized just a bunch of details in my life came out that like it made it pretty, it was like it's tricky with this childhood trauma that I have, because it's like I don't have a memory of it because I was too young when it happened, and the like details around it are really really fucking sus. But obviously I can't say 100% because I don't remember it, and like it was never documented. It's just like all of the situations around it, and basically certain mental health things that were like weird, like panic. Like I had kind of trauma reactions when like men would touch me and stuff, when it's like I had no negative reactions to men. I had no negative experiences with men in my like memory. That just like added up for me. And I remember, so my anxiety around that is kind of similar to where I remember I'd be walking around and my body was like, something's fucking wrong. And I'd be just like listening to soothing music. And I was like, what do you mean? And it was just this weird experience of like realizing that this trauma had happened. I feel like for me, I really process like experiences at like a body level. That's the best language. Like in psychology, this thing that you're describing is kind of
it's not what's happening. You're not responding to the environment. That's the scary part. Yeah. And every panic attack was like that. It was like, if I have a panic attack, something scary is happening, that's awesome. That's great. Because if I remove that stimulus, then I don't have a panic anymore. Yeah. The worst part is like shit what just happened and that disconnect. Oh yeah, it's
awful. You're like, I'm literally walking home. It's bright out. I can see for fucking miles because it was a very wide boulevard of like, it was like an open courtyard to my home basically. And I'm listening to literally calming, like intentionally calming music. And I want to fucking sprint home because I'm so afraid. And it's like, why? There's nothing in my life. I have no I've never been attacked on it. Like there's nothing. And it's so distressing of this moment of being like, it feels like your body, it's like really why I can understand why there's like this dualism of like the mind versus like the brain, right? Because it's like, it feels like your like mind or your body is like actively at war with your like cognitions, where you're like, I'm not thinking anxious thoughts. My body wants to fucking sprint and save me and like keep me safe. And I don't know why. And there's no reason for it. It's very strange, and I actually think that it's something in psychology that people are really just starting to get into. And the problem is that there's a lot of good research coming out about it, but it's like, how do you study it? I think
because we can't communicate the experience to each other. It's so fucking frustrating.
Define empathy in an operational definitional way that I can measure it, right? Fine, good luck. Maybe if we can find some like brain pathway that does it later. And so, there's kind of this like, that's why I think I mentioned to you before a book called The Body Remembers by Babette Rothschild. She's an excellent researcher that really taps into basically like these weird things that happen where basically like we have this like bodily response that is completely contrarian to our mind, like our thought life. And it's so deeply strange because trying to explain it to people is like the worst fucking thing ever. Because if they don't get it, they don't get it. And there's no way you can give them the insight. It's like if you can see it, you can, and if you can't, I don't know what else to do other than being like, you probably don't get it, right? And it's very tricky, and it brings up something of like why a lot of psychotherapists have kind of argued that like CBT is insufficient. Like CBT is a band-aid therapy. It works really well for certain very specific things, but overall, if somebody's having something like what myself or you were having, I would argue like my thoughts were fine. My thoughts wouldn't have changed anything. It was my body. And I don't even know if it was my body. It just felt like that's the best.
Or some other part of your mind. There's something deeper than your thoughts. It's like the foundation. Yeah, I think it feels like one of the worst things is that if a person doesn't have a frame of reference for the experience, they'll fundamentally not understand you, and then that lack of understanding leads to a lack of I don't want to say empathy, because people can empathize for you, but they just don't really understand, you know? Eventually people will get tired of like, okay, like you've been sad or whatever, but it's time to like move on. You don't have a reason to be sad.
Yeah.
Like if you don't have that experience, it's really hard to empathize with it. Yeah, and it feels like an incredibly alienating thing.
Yeah. Yeah, I feel like at this point I have to be like, are we having therapy? I'm just kidding.
Mm-hmm.
I'm totally shooting
Oh,
with you.
fuck
That was
you.
a joke.
I'm not your therapist, okay? Yeah.
Yeah, are you giving me
No.
therapy right now, Destiny? Because
Yeah.
I feel healed.
Hold on, what time? Okay. If you want to go for too much longer, it's $150 an hour. Steven.bonnell.ii@gmail.com. That's if you want the creator coaching package, because technically you're a streamer now, so I would have to bill you at the higher rate, unfortunately. So
True. What benefits and costs would be, other than the actual cost, what benefits would I glean from this package deal?
that's the benefits are incredibly personal, and that's for you to explore and discover. What you get out of it is what you put into it. So,
Okay. I think I'm going to pass for tonight, mostly because I'm broke as fuck. But what if somebody seriously takes you up on that and they genuinely think you're offering
coaching or therapy?
Yeah, what if somebody listening is like, really? Would you ever do coaching or therapy? Like for, like as a business strategy? Like, what's it called when you're not a therapist? You're a life coach.
Life coach? I feel like, it sounds really sad to say this. Man, this is really depressing. Maybe this isn't true. I'm just full of shit. It feels like most of the major parts of your personality are like pretty in place by the time you're like 16, 17, 18. And those don't move much as you age without like a huge earth-shattering experience
like a
to
conversion.
kind of like move you.
Yeah.
That like, I know like brain doesn't start or stop until you're like 25, around there developing. But like it feels like if you got a person that's like 17, 18, they've got like major self-esteem issues. By that point, by the time they're graduating high school, I never see these people like through college like, oh yeah, like I fixed all these issues. And I'm like, it seems like a lot of the major parts of your personality. I feel like there was more research coming out recently that shows the your first like 4, 5, 6 years of development are so important to you as a person.
Yeah.
Which sucks.
Yeah. Like, so it is literally your foundation for your emotional regulation.
Mm-hmm.
Like, foundation.
Mm-hmm.
And so if you have to rebuild it later,
even in like kindergarten and first grade and second grade, there are those kids that like studied super fucking hard and did all their homework and they had perfect handwriting and shit. And they were the ones that in like high school and college were the really good studiers and everything. Like it seems like a lot of those get set like pretty early. So like when people ask me questions or whatever, I feel like really high self-esteem is like the foundation of almost every single like major personality thing that you can do. It's the foundation for your relationships. If you don't respect yourself, if you don't have an idea of what you want, you can't like. It's the foundation for your business relationships, your confidence, and your navigating these types of things. The foundation for sexual, for literally every relationship.
Mm-hmm.
And if you don't have that self-esteem thing figured out, you're pretty fucked. And you can try to fake it till you make it, but like something is going to break around the edges because you don't genuinely have that in place. And I don't know how to tell somebody to develop a high amount of self-esteem or resiliency. If I did, I wouldn't be streaming. I'd be selling like $1 billion book tours or whatever.
Yeah,
because that would be like the most important question to answer, I think, of all of humankind. How do you genuinely make somebody have like high self-confidence, high self-esteem, like truly like themselves? Yeah.
Yeah, like literally most of psychotherapy could be solved if we could figure that out. I mean, I do think that there is something that you can do for it, but like you said, it's kind of like those rare like damn near conversion moments, and it like requires like so much work. And like the reality is like this is where I think like psychotherapy could be actually really deeply meaningful if we could like this is where I think psychotherapy can be an art. And I actually think that this is where Dr. K is like most artful at, which is like because for me I actually had really terrible self-loathing after being like I would say like broadly overall, but especially in high school when I got like bullied a fair bit and afterwards. And it's taken me a long time, and I actually rebuilt most of it pretty well. Like I definitely have down days, but overall I can navigate it. And like honestly doing kind of like this type of like almost like narrative therapy where you kind of like go back, and it's very psychodynamic-y and it's extremely woo-woo sounding. For me, that was like like that was what made the shift. And I actually didn't even like do it in psychotherapy. It was like mostly in talking with like my partner and stuff like that. But Yeah, in forensics, we actually talk about how like one of the best ways to like actually guarantee that a client isn't going to recidivate is to like
Oh
have them
man.
experience a religious conversion. Like that's one of the best, like legitimately. Which I know a lot of
I
people are like,
wonder.
ah, but it's like it seems to just it's very similar to what happens I think with psilocybin and stuff. Is there's like this
Mhm.
like there's almost like a restart in the brain.
I wonder if, yeah, that wouldn't surprise me. I think the biggest thing, yeah, I say one thing. You worked in addiction.
Hmm.
So this is like quadruply true of the people that you work with. The one of the most important things in determining your success is your environment. I know that you've probably counseled people and you've sent them out the office knowing they're going right back to a group of friends or family that are users and they're
Yes.
fucked.
Yeah.
There's less than 1% chance that they're going to be on a track to success.
Hmm.
Um, and I feel like you could probably expand that to a lot of therapy to where, and it's depressing. Even conversations I'll have with certain people. Like I know that like back in high school or college that like no matter what we talk about, like you're going back to super shitty parents, super shitty friend groups. Like um, the support structures that exist around that person almost demand failure.
Yeah.
There's just like no way that an individual, like the only type of individual that could thrive or have the resiliency to make it out of that environment wouldn't have been in therapy in the first place. So like the people that need the help the most are in the environments that like fuck them the most. And it's like, yeah.
Yeah, I mean, in addictions, we encourage people to move cities when they get out of rehab. Like, don't go back
Hmm.
to the same city and cut off all your friends. And the reality is, most people aren't willing to do that, and it sets them up
Yeah.
for a whole bunch of other risks. Yeah,
Hmm.
overall, like, I mean, this is where like this is an area where I think like psychology bleeds into like politics and society, right? Is like I think it is self-evident to me that like society is failing
Hmm.
as far as like dealing with emotional needs of people. I don't think like we'd be seeing the rates of mental health problems that we do if there wasn't something off with
Yeah.
society, right? But it's like, how do you solve that problem? Okay, well, we could talk about like housing market and being like, probably
Hmm.
people shouldn't own single family homes. Probably we should have like community based apartments, and like really only the people that need a house are like farmers who like actually live like where they need a ton of space, right?
Hmm.
Yeah, it's so difficult having a client, and like this is why I genuinely say like I think therapy needs to broadly be long term, and group therapy should become bar none like a standard, because then you can offer them a new environment potentially, because even though they go home to the same things, if you even have like two friends, like when I think about like my area episode in stress depression was really bad and I was getting passively suicidal, I had two friends who were fucking on top of it, and they didn't even live in the same province. They just called me. One of them took it on them to like call me every day just to like check in and make sure I wasn't too lonely and stuff like that.
Hmm.
Man, if you can give
That
people.
having that person that can like get the fuck out of bed, we're gonna go on a walk is probably one of the most important things that you can have.
Mhm.
It has to be somebody that has an understanding of like I remember that I did this for my ex had issues related to her mental illness, and sometimes I would sit in on some of the therapy sessions and learn like the coping mechanisms or like the tools that they would use to like where is your mental status at right now. Like I think they would use like, are you at a 1 to a 7? If you're past a 3, what are the tools that you need to apply to bring yourself down to a 1 to a 3? And then you can kind of, it was a CBT stuff, right? Yeah, to work your way
Mhm.
through it. And having, she's a very smart person, she's not an idiot, she's very, very, very smart. But sometimes having like me there just to say like, hey, like are you at like a 5 or a 6? Like do you need to do this?
Yeah.
Like those kinds of like reminders. But it sucks because so many people that suffer from these issues don't have anybody else in their life to do those things,
Yeah.
and they're like fucked.
And they have to be open to receiving it. Like I feel bad for my partner sometimes, because it's like because of like my weird family dynamics and stuff, like sometimes you don't want to like, sometimes the things that are like making your life the most problematic isn't just like I'm sad and anxious, it's like I'm kind of being an asshole and people are leaving
Hmm.
me as a result, right? I think part of like in the midst of my depression what was going on that was like making it so much worse is like I was assuming everyone was being mean to me, and necessarily I'm probably not treating them great. Like people don't like being assumed that they're being like terrible people usually.
Hmm.
And so like I think that's the really tricky is like there's a lot of people who say that they're like willing to be there for people, because when they think about it they think about like the nice stuff, like being like, hey, if you're sad, let's go on a walk. And like most people, I think, I wouldn't say most, but I think there's a lot of people that are willing to do that. The problem is there's not a lot of people willing to be like, hey, you're being really toxic right now. I still love you, but holy shit, like this isn't okay and we need to talk about this, right? Like that's a whole other level of engagement that is actually oftentimes required, especially if you've got somebody with mental health problems who had like not like an abusive family, just like kind of a weird broken family dynamic. So they learned a lot of weird ways of engaging around emotions anyways. And like our culture, like if you have like any Protestant history, you might have like a lot of shame around like any bad words. So if they say like, hey, I think you're being like kind of manipulative, they're going to be like, you're saying I'm evil, and they just like will absolutely refuse it because they can't acknowledge that they're evil. And so it's like, I don't know how we do this, because it sometimes to like be that person to help somebody like pretty mentally unwell like through everything requires you to be like so solid yourself, basically.
Yeah.
Kind
Yeah.
of the anchor point. And that creates a weird dynamic, because a lot of times like people don't want to feel like lesser in a relationship. They don't want to feel like you're all like, it's going to be frustrating if this person's like kind of always right, and they're going to be like, oh, you're just like being a dick because you're saying that you're always right, when like they literally might always be right, because like right now you've got like some serious mental health and you've got like some weird childhood stuff that causes you to like not engage well with certain like emotions and feelings, right? Yeah.
That's something that I, even when it comes to advice on anything, I have to check in with people sometimes, like, do you want me to mention anything about this, or should I just shut the fuck up? Because I'm definitely a very hard-headed person. I don't mind feedback or whatever, but I can get like irritated sometimes. Yeah, but so I don't want to be the person that's like pissing somebody off by offering unwanted advice. Yeah, that's a difficult.
Yeah, it's tough. It's tough because it's like, it's easier to help people who like deeply know themselves, but usually people with like decent mental health problems don't, right? Because it's so hard to tease apart what is my mental health, what is me. Like that's so complicated. And so like, you know, I'm decently hard-headed, except for when I'm having those weird days where I'm just hella insecure. And then it's like, don't critique me that day. I'm just going to like cry and think I'm a terrible person. But normally it's fine. Like it's literally fine. And I think like I've grown hopefully enough that it's like when I'm having those days, I'm getting a lot better at being like, just so you know, I'm a sensitive little bitch right now. Like just go really easy on me. I'm taking everything personally. It's not you, it's me. But like if you've got serious critiques, maybe another day.
When you have days where you feel like insecure, what is that similar to like the depression like feeling, where this is like some all-encompassing foundational thing that's just creeping that you have no control over?
Yeah.
Or
and then you like you talked about like the crazy texts you'd like send X, like that. I mean, I've learned to like not be like I mostly just suck at texting people back, but yeah, it's definitely like that. It's like all encompassing, and then I can go to sleep and like wake up the next day and it's like, LOL, remember when I was kind of crazy yesterday? Ha! Like, right? And then we like joke and kind of move on, right? Or we don't, because then sometimes like, you know, you feel like a bad person because you're like requiring so much of your level. Like it's so complex, right? And that it's like, this is why I actually think like the conversations around like actual modern relationships, I think is like so important, because like we don't barely know how to do friendship well, let alone like intimate relationships. And the landscape for relationships has changed so much that like what it means to be in a partnership has totally changed. Yeah.
Dude, I always wondered if like, because women have periods, if they are more able to deal with some types of emotional or mental like mental illness swings than men. Like as a man, we don't really, or at least I'm not aware, we don't have like a once a month thing. And I get it varies from person to person how much of a mood swing you'll have from PMS or whatever. I've always wondered if like, because it sounds crazy. I've been with some women that don't, they just get a little irritated, and then some that go crazy for like 1 or 2 days. If that like enables you to deal with mood swings from other emotional things, or if it's just not at all.
I don't. I have no idea. That's a good question. It's probably a better question for my husband than for me, to be honest.
Like for me, like
I'm
I
like
can
somewhat
never
unself-aware.
Yeah, because I couldn't imagine just like feeling like really out of my mind for like 1 or 2 days, like every month or whatever. It just seems like a really weird thing to me.
Yeah, and then it's frustrating, right? Like it feels frustrating, like you're getting infantilized when people are like, yeah, but you're just being kind of crazy because you're PMSing. And I think like I can understand why women get so frustrated with that, but like we have to do the dual side of like some women get really, really affected. Like I have a chronic gut problem, and when it flares up, like because I'm really reactive to like fiber, it's really obnoxious. And when my gut acts up, that's oftentimes really connected to the same days where like I'm having a really low mood and stuff like that. But sometimes it's not acting up, it's just like something environmentally happened like 2 weeks ago that I'm sad about now. And so it's like it's so tricky, because I think like we very much think that we're like these drivers of our brain, and like we're the ones steering the ship. And then when somebody says like, hey, just so you know, like you might not be driving the ship today. It might actually be like anxiety driving the ship. It feels like you've just told me that I'm not a valid person, right? I think like for a lot of people, like the emotional landscape becomes like reality. And I think for women, we are more likely to fall into that pattern of viewing our emotional landscape as reality, because I think like socially we're taught that it's more okay for women, because like emotions are more okay for women, like, and that's why you run into situations where and I'm not like throwing other women in the bus, like anything I say like women do, like I do it sometimes too, right? Which is like, and men do it too, obviously, as well.
I was gonna say, yeah, because men definitely will get violent or some
Yeah.
crazy thing, and
Yeah,
for some
exactly.
reason, yeah.
Exactly, right? So maybe I shouldn't say women, but like there's definitely this emotionally immature thing that happens. And I feel like I've maybe dealt with it more often from women, but that again could be a selection bias, where it's like, I feel hurt, therefore you must have hurt me. And it's like, maybe, but like maybe you just have like something. Maybe your gut's just really fucked up today. Maybe the fact that like your boss said like that shitty thing to you 2 weeks ago is like actually kind of like at a bodily level being processed. Like who knows if you're hurt because I actually hurt you, or because if you were it was a different day you wouldn't care.
Yeah, but it's impossible to point that out to a third person unless you have to have like like with my kid's mom, I could tell her like, you are PMSing hard because you're getting really mad over dumb shit. But we'd had those conversations a lot, and she was like, yeah, I am. Like, just leave me the fuck alone for a day and I'll be fine.
Yeah.
Or like with my kid, like it is. You don't have any kids yet, do you?
No.
Okay, it will become painfully obvious to you when you have a 5 or 6 year old that needs a nap. Okay,
Yes.
They're bitchy, cry, whining.
I've nannied a fair bit, so I've worked a lot with kids.
Yeah, it's like, bro, and they will fight you. I don't need a nap. I'm not tired. Blah blah blah. That's like, okay, and then I don't know if you've done this before, but I made the same deal every time. Okay, here's what we're gonna do. Okay, you don't have to take a nap at all. I just want you to lay down for 5 minutes, and if you don't fall asleep, you can get up and play video games. Right? I made that deal with Nathan like 100 times, and he would lay down, and he's absolutely out in like 2 seconds. He's like, you're so tired, you just can't realize it.
Yeah.
But it's like, that's like a very like parent to child transaction. So to tell another person that you're more cognizant of their emotional state than they are requires like a lot of trust in that relationship.
Yeah,
So, yeah.
Especially if that's been weaponized against them, which it like people
Yeah,
like
which
that,
people
this
do.
is the shit, is like people weaponize your emotional state, and this is why women get really like testy, is because it's kind of this like archetype of like, oh, you're just a crazy silly woman. And the problem is that women use that as sometimes both an out of being like, haha, sorry, I was just being a crazy woman, and then sometimes it's like actually meant derogatorily. And so it's like, I can understand both reactions, and it just makes it so messy. Like, how do you navigate this? And it's not clear. I find like I don't know, my theory is kind of like, at a very generalized level, it seems to me that like women generally, like their emotional and social landscape are so real that they like can't disentangle themselves sometimes from it. And for men, it's like their emotional side is like kind of been culturally taught to be so unreal that they like reactively spew it out on the side. Yeah, that like rather than right, because when men kind of like blow out in like aggressive rage and stuff, it seems like it's more of like it's sliding out the side and like smashing people in the face on the side. Whereas like women, I feel like they often, again, these are generalizations, will like put their emotions on other people and be like, my emotions are your responsibility right now, right? And it's like, how do we navigate this?
Yeah. Sorry, I'm just gonna open your brain on everything. I feel like there are 4 things that solve every single mental health problem.
4 things, okay.
The 4 things, okay?
All right, hit me, Sensei Destiny.
I don't know.
Or should I say Therapist Destiny?
Only after the PayPal transactions come through.
Okay, well, that's going to take a year at minimum, so just
I feel like diet, exercise, sleep, and like active social life, I feel like are the 4 like pillars of like mental health.
Okay, you're going to hate me, but Jordan Peterson says the same shit all the time.
Oh, fuck.
It's not wrong. That's the problem, is you're right.
Does he really say those 4?
He says the first 3.
Oh, okay. The social part is important. You need
it is important. Yeah, people, and I think he would agree.
You need friends and shit.
Yeah, but usually he recommends, because the social support is more complex for people to work on. So I think he usually recommends. I also usually recommend the first 3 because that's something you can entirely take care of by yourself, regardless of what other people do. But yeah.
Gotcha.
We have a little budding Peterson fan.
He has such a nuanced understanding and view of psychology, and then when he talks about politics, he's just so fucking stupid. I don't understand. Oh my god, it hurts to listen to him talk about politics. Jesus. But regardless, okay.
Yeah.
Is that it?
Overall, yes, I would say. And one thing I would add to that is there are not enough mental health practitioners recommending that first and foremost.
Yeah. I don't blame him because it's like,
I always do.
oh,
Always.
sure.
You can
It's
actually
good, but
do
it's
it
like
pretty
it's one of
easily.
those things where it's like somebody comes in and like, what should I do? And it's like, well, clean up your diet, get some exercise, and make sure you're sleeping. And they're like, okay, well, fuck you. Obviously, I know I should do that. I don't need a fucking therapist. I'm not paying you $75, $80, $100, $150 an hour to tell me that I need to. Yeah.
I mean, I'm a little bit more tactful, I think, in how I work them in. Usually I select like one at a time that they think is the most problematic, and I tack it onto their homework plus other psychological stuff that I get them to do, so that they're not just like glaring at me because I'm like, okay, your homework is, eat well, exercise, and sleep well.
Yeah. Live. What is it? Like live, love, laugh,
Love.
or some shit.
Yeah,
Yeah.
and then I give
Whatever.
them one of those posters and then walk them out, and then they crochet me a picture of my face on a pillow next week. Yeah.
What do you think about Do you think that Dr. K is overall a positive or negative for Twitch in the world?
I think he's an overall positive.
Why?
Um, I think he's brave enough to give like the psychoeducation that people need, in a really honest way. Um, I think he's actually a really good psychotherapist. Actually, I would argue this might be an issue is that if people watch him and then they go and see a therapist and expect kind of this like really narrative style of
Oh.
therapy, it's some like practitioner style, right? Like I use that style sometimes with the right client if they really enjoy it, but it's definitely not like CBT is a pretty standard style for a lot of psychologists, which is fine. That's the most like often recommended. It's probably the most empirically sound overall, and so that's one thing that I'm concerned about is that people will be disappointed when they like are like, oh, okay, I'm willing to go to therapy, and then they expect Dr. K, and they're not going to get Dr. K, right? Because most people like don't go into like all of this like mythos archetype narratives, I would be, I guess the main reason why I think he probably is a more positive than negative is like honestly like probably not the best metric, but like it seems to be broadly that people are responding positively to it and highly reporting that this has been really helpful to them basically. And obviously like there's going to be a selection bias, but I find like there's a certain bit of like honesty, especially when you start getting like mass amounts of reporting, right? Like
Okay.
if 10 people say that they love this guy, okay, well, whatever, if you've paid enough for something, you're obviously, or like spent enough investment of yourself, cognitive dissonance dictates that you're going to want to say something positive, or people are just like nice. But once you start getting into like really big populations, especially on like YouTube, that are like diligently ruthless a lot of the time, and you still see consistent responses of like, this was so helpful, this like changed my life, they like helped me like actually like finally get purpose in my life, I'm like, I can't dismiss that. So I'm not going to say outright like I 100% think that he's only doing good, but it makes me lean that he is doing probably broadly more net positive than net negative. But I think the ethical stuff, to be honest, I think if he's big enough that he wants to like risk the ethical violations that he's like towing on, he should just honestly start advocating for why certain ethics might need to change. I think that would actually be like best practice from him.
Gotcha. I think I largely agree. I think it'd be hard to advocate for an ethics change that directly benefits your for-profit business model.
Yes.
Would probably be a hard one to do, but
Yeah, but start talking with colleagues about it and really encouraging
mhm.
it and challenging them on like why it's not right, which I don't know if he does, right? But yeah.
Sure, sure.